Good afternoon. Welcome to Senate Finance. Today is Wednesday, March 22nd. We have, 11 bills before the committee today, and we're going to take them in the following order, subject to change based on the arrival of our colleagues from across the street. The planned order is House Bill 26, House Bill 321, 400, 507, 615, 884, 913, 1111, 27, House Bill 694, and House Bill 1012. We have a combination of bills today. Some will be sponsor only, some will be full hearings, depending on whether or not the bill has cross-file or opposition. To our guests, we will allow the sponsors to present the bills. If you are testifying on a bill that allows more than the sponsor, there will be a 2-minute timer. And when you hear the alarm go off, we ask that you just wrap up your testimony and thank us, and you can go on about your day. To those in the audience, our guests, we just want you to know you see some empty seats. You'll see members leaving in and out of the committee. They're presenting bills in the Senate and also in the House. So their lack of presence is not meaning disrespect to you or your bills. We just have a lot of work going on these final weeks of session. With that, we're going to turn to House Bill 26, Health Occupation, Psychologists, Licensure, Qualifications. Good afternoon, Delegate Bagnell.
Good afternoon. Thank you very much, Madam Chair, Madam Vice Chair, members of the committee. For the record, I'm Delegate Heather Bagnell, District 33C, Anne Arundel County, here on behalf of House Bill 26, Health Occupation, Psychologist, Licensure, Qualification. You have my written testimony, so I will quickly summarize. Last year, our office became aware of a difficulty for some postdoctoral psychologists wishing to move from non-clinical to clinical settings to respecialize as clinical psychologists. House Bill 26 creates an additional avenue for postdoctoral psychologists who hold doctorates in a non-clinical psychology field to respecialize through appropriate programs and training to enable psychologists to meet the educational requirements for licensure. This is specifically for postdoctoral psychologists who hold doctorates in a non-clinical psychology field to provide a pathway to clinical licensure without requiring the completion of a secondary doctorate. This pathway for meeting educational requirements for clinical licensure for doctoral psychologists is already standard in Maryland's surrounding states, as well as within the federal government, within the VA, and the military. 40 states have open criteria allowing requirements to be met without a full respecialization. And with the great need for behavioral health services, House Bill 26 is an important workforce development bill for the behavioral health workforce. The bill before you represents hours of work and consensus with all stakeholders, including the Board of Examiners of Psychologists, who worked in good faith with our office to ensure the high standards of the profession are maintained, and is in the same posture as it passed the House unanimously. Last year, there was no opposition in the Senate. We simply ran out of time, but this bill will be new to you because last year it was also in EHE, not in finance. We have a significant deficit of licensed clinical psychologists to address our behavioral health needs statewide, and House Bill 26 provides an essential tool to licensure for doctors who want to provide for patients. House Bill 26 has no opposition, and for all these reasons, I would respectfully request a favorable report on House Bill 26, and I would be remiss if I did not acknowledge my amazing senator who visited our committee yesterday, and now I have the honor of visiting your committee today. Thank you very much.
Thank you very much. Are there any questions for the sponsor? Seeing none, that concludes the hearing on House Bill 26.
Thank you very much.
Colleagues, will turn to House Bill 321, Cigarette Restitution Fund, Payments for Sale and Marketing of Electronic Smoking Devices. Delegate Rosenberg, good afternoon.
Good afternoon, Madam Chair and members of the committee. House Bill 321 deals with the Cigarette Restitution Fund and the most recent settlement that Maryland and most of the other, if not all of the other states have entered into with one of the manufacturers, specifically with Juul, Juul, for electronics cigarettes. And since these cigarettes were, or since this product was targeted to youth as a pathway, the suit alleges to get them to smoke the real thing. What this bill does is mandate that the money we are receiving, I believe estimated to be 13 million, be targeted for one use of one of the permitted uses of the Cigarette Restitution Fund, which is deterring people under the age of 21 from getting started smoking. So the cause and effect, or cause and prevent, if you will, since this money is derived from a settlement with a manufacturer that targeted people under the age of 21, this bill mandates that the money we receive be used exclusively for the purpose of deterring minors, people under the age of 21, from smoking. And that's what this bill would do, and I would urge a favorable report.
Thank you very much. Are there questions from the committee? Senator Hayes.
Thank you, Madam Chair. Delegate Rosenberg, you talked about the permitted uses. Is behavioral health one of the opportunities that could be used for this fund? I'm curious. I know there was talk about it in previous years. I'm just curious, or I could find out later.
I'm pretty sure, without looking at the bill again, that it is not, because their uses, with one exception, are related to, in the statute, the uses are related specifically to tobacco and the harms from tobacco. Now, there's language that allows it to be used for Medicaid in general, and so that's become really far more of the money than the advocates and myself would have liked has gone for Medicaid. But
And
so
folks
that's
have
why,
found creative ways to interpret that, right?
correct.
Got you. Thanks, Madam Chair.
I'm all for creative ways if they're my creative ways. Yeah,
Well,
thank you.
Thank you. Thank you, Senator. So I have another creative way. I wonder, I would like to spend some of this money. No, I wonder if cessation is also included is that already covered
Yes.
under this, and
Yes.
treatment for those who,
The concern has been that not enough money has gone to cessation because it's gone to Medicaid.
okay, very, very good. Are there any additional questions? Seeing none, thank you very much.
Thank you.
That concludes the hearing on Senate Bill 321. We're going to turn to, I'm sorry, that was House Bill 321. Whoops. We're going to turn to House Bill 400, which is Commercial Law Ability to Repay Verification Exemption. And we have Emily
Gilliland.
Gilliland. Thank you. Good afternoon.
Thank you. Good afternoon, Madam Chair, Madam Vice Chair, and members of the committee. I am Emily Gilliland, and I am Delegate Kipke's legislative aide, and the delegate could not be here today. House Bill 400 exempts loans made by community development financial institutions from certain requirements to verify a borrower's ability to repay the loan in the state of Maryland. Maryland does not have the same exemption for this simple reason that the law enacted ability to repay, and a needs test requirements were adopted in 2010 before the federal government weighed in later in 2013. There are 15 CFDIs in Maryland. CFDIs are exempt from federal ability to repay regulations. The Consumer Financial Protection Bureau is an agency of the U.S. Treasury Department that implements and enforces federal consumer financial laws and ensures that the markets for consumer financial products are fair, transparent, and competitive. The CFBP granted this exemption in 2013, acknowledging that many consumers not only deserve the opportunity for home ownership, but can also demonstrate a high likelihood of loan repayment, despite an inability to conform to traditional ability to repay and needs test standards. CDFIs also provide capital to the underserved communities from which many of these consumers reside. House Bill 400 will provide the underserved communities of Maryland with the same tools to achieve the dream of home ownership that exists currently in 43 other states. There was an amendment that was provided to staff. That's a technical amendment that will include mortgages in Maryland made under the commercial law title 12, credit regulation subtitle 1, interest and usury, which is where the majority of the first of these mortgages are originated. Brendan McKay from the Maryland Mortgage Bankers and Brokers Association is here to answer any questions. He's behind me. And we request a favorable report. Thank you.
Very much. Any questions on the bill? Seeing none, thank you very much. That concludes the hearing on House Bill 400. We'll move to House Bill 507, State Board of Physicians Supervised Medical Graduates. Delegate Lewis, good afternoon. And for those of you that are just joining us, we're moving through our sponsor-only bills first, and then we'll get to the other hearings shortly. Good afternoon.
Thank you, Madam Chair, Madam Vice Chair, esteemed colleagues of Senate Finance. I am Delegate Robin Lewis, representing District 46, and here on behalf of House Bill 507. This is a healthcare workforce bill, and I know the members of this committee are well aware of the healthcare workforce crisis we have in Maryland. This bill will tackle one slice of that workforce crisis, and that is the pipeline of physicians. House Bill 507 will construct a bridge to medical residency training for those individuals who've received a medical doctor or doctor of osteopathy degree and also completed parts 1 and 2 of the medical boards, the US MLE exams, but failed to match or secure a residency training spot. Not many medical and osteopathic graduates fail to match, but those that do are a loss, not just to our society in terms of the wasted investment that we have poured into these talented, brilliant, and capable people, but a loss to our healthcare workforce. So the bill works by setting up, authorizing the Maryland Board of Physicians to set up a regulatory program under which these medical grads will work under direct supervision of licensed physicians. The Board of Physicians is a partner in this bill and support it, and they're willing to create the guidelines for this cadre of worker. You have my testimony before you. I'll just close by mentioning that this is an emergency bill, and the reason for that is the medical graduate matching process is actually happening right now. I think matches or the training program announcements were made last week. I think some will be made this week. We're losing even a few doctors a year. We're losing out on tens of thousands of patient contacts. So with that, I'll urge your consideration and favorable report. Thank you, Madam Chair.
Thank you very much. Senator Lamb.
Thank you, Madam Chair. The match was last week and everyone matched. Anyone that could match as part of that match process was last week. It's interesting because I run a residency program at one of the health institutions here, and trying to think through how this might actually work in some of our healthcare facilities. And I was looking through the bill, and a lot of it seems like it was struck from what was initially introduced, rather. So I'm trying to see if you could help us envision how this might actually work with folks or work in practice in some of the clinics and hospitals under this bill, because it, as written, says that they have to be directly supervised by a physician in the room with them, which is a very narrow scope of practice than even what like a current medical assistant can do with certain tasks that they can do with like sample collection and medical histories without that direct supervision. These folks are almost like first-year medical students that they can't, to actually have them in the room with you. Like for residents, we will allow them to see the patient. They'll come back, report to the attendings, and then we'll go back and see the patient with them. But it's very limited, like what this would even allow.
Mm-hmm.
Can you speak to what was the vision of the committee coming out of the House over there?
Yes, I can. Thank you, Senator, for the question. And yes, the match was last week, was March 17th, as I recall. But I do believe there is a process for those who don't match in that first round.
There's a scramble.
Yeah, the scramble, right. But it doesn't always work out for people, as you know. With regard to the design of the bill and the agreements that were made, the Board of Physicians felt the original bill proposed to create a new license, a medical graduate license. The Board of Physicians felt that would be onerous and not the best use of resources, because in fact, there really are only maybe a handful of unmatched medical graduates every year. So to stand up a whole licensing structure and all that would be not be the best use of resources, they felt. the model that we've accepted is this direct supervision model. It's used for some other cadres of health worker. It's not ideal for someone who's graduated medical school and completed parts 1 and 2 of the boards. These are highly trained people ready to work at a high level with some autonomy. However, other states have done it this way. And I think that here in Maryland, since we've not even tried this is a good way to get started. The regulations that the Board of Physicians will develop will be made in concert with other professional boards, PAs, et cetera, to make sure that there's some alignment, not a lot of overlap between what these cadres will do and how they'll work with others. In practical terms, what does this look like? This looks like a medical graduate wanting to work, approaching a training program and seeking the opportunity to work under supervision. There is no administrative structures available right now to guide them. This is a bill with no fiscal note. That type of structure might cost a little, and we just wanted to create the opportunity to get started. The Hospital Association is open to thinking about how they can step in as an intermediary, broker, facilitator of appointments. But I would love to, with your expertise, I'd love to hear any suggestions you might have about how we could clarify the process.
Got it. Yeah, I mean, the scope just seems very, very narrow. As someone who's trained medical students before, if they're coming into the room with me, I'm happy to teach them. And that's what the exercise turns mostly into, but it doesn't provide the value added capacity that I think folks are concerned about when it comes to our healthcare workforce. It'll probably slow folks down more than it might actually help with capacity. And I just want to be, clear about that. I guess my last question pertains to, you mentioned MHA and where the hospitals are. I'm wondering if there have been conversations with hospitals about whether they would go through the level of the effort required to credential these folks, because these folks would still have to be credentialed just like any other provider in the clinical environment, when there's expense involved in the credentialing, and they could also, for the same amount of effort, credential a medical assistant who might actually be able to do things on their own without, the direct supervision of having to be in the same room. Did the hospitals give any indication whether they would even be willing to credential these folks?
I don't think we had that conversation. I'm willing to have it and to get back to you with an answer. They've been really supportive partners in the conversation. So I venture to guess they might be. So I'd be happy to get back to you.
Okay.
Thank you for the suggestion.
All right. Thank you, Madam Chair.
Thank you, Senator. Seeing no further questions from the committee, we thank you for your testimony. That will conclude the hearing on House Bill 507. Colleagues will now turn to House Bill 615. Work Group on Black, Latino, Asian American, Pacific Islander, and other underrepresented behavioral health professionals. Extension of dates. Delegate Amphrey, good afternoon.
Good afternoon. The title of the bill might be longer than the words I have to say. Madam Chair, Madam Vice Chair, members of the committee, thank you for your time today. For the record, Delegate Marlon Amphrey here in support of House Bill 615. It's being introduced for the purpose of extending the reporting and termination dates to 2024 and 2025, respectively, for a work group that will be formed under a bill that we passed last year to ensure that people of color and other underrepresented behavioral health professionals have access to, that we diversify the field. This bill targets a shortage of providers of color and those otherwise underrepresented groups in the mental and behavioral health professions in Maryland. In forming a work group, we hope to develop evidence-based recommendations on incentives, systematic changes, and other methods that can increase the share of providers from these groups. The work group is poised to include academic leaders with special expertise in diversity and inclusion and a diverse group of mental health providers all working together with the ultimate goal of developing a plan that will bridge the current disparities between the racial and ethnic diversity of patients and the provider workforce. It's critical that this process is not rushed or overlooked, and that work group members are given sufficient time to develop recommendations and put together a comprehensive report. Thus, I urge a favorable report on House Bill 615. Thank you for your time.
Thank you. I don't see any questions from the committee, so thank you. That concludes the hearing on Senate bills. I'm sorry, I've been doing that all year. House Bill 615. We'll now turn to House Bill 884, Baltimore City Delegation. Insurance certificates of guarantee for county bond requirements. Good afternoon, Delegate Smith.
Good afternoon, Madam Chair. It is my honor to be physically in this committee. I've never physically been here before. For the record, I'm Delegate Stephanie Smith, representing the 45th District, here to present our delegation bill, House Bill 884. And it's a very simple bill, and I mean it. All it does is it authorizes, it does not require the city of Baltimore to honor certificates of guarantee that are issued by a nonprofit association of contractors. And these types of certificates of guarantee are generally issued to satisfy county or city bond requirements related to different infrastructure improvements like streets and so forth. And so this is just an alternative to other forms of certificates of guarantee being issued. It does not require the city to honor them. It simply authorizes the city. And other counties that have authorized this same honoring of certificates of guarantee include Calvert, Charles, Howard, Montgomery, Prince George's, St. Mary's, and Washington counties. So I do hope to get your careful consideration and support for House Bill 884.
Thank you very much. Any questions from the committee? I appreciate the way you gave that little extra emphasis on Prince George's. Noted. Thank you very much. That concludes the hearing on House Bill 884. We'll now turn to House Bill 913, Financial Institutions, Student Financing Companies, Required Registration and Reporting. Delegate Lopez, good afternoon.
Good afternoon. Thank you so much, Madam Chair and Madam Vice Chair, colleagues in Senate Finance Committee. For the record, my name is Delegate Leslie Lopez, and I am here to ask for your favorable support on another simple bill, HB 913. It is a simple reporting bill that requires student loan companies acting in Maryland to register with the Commissioner of Financial Regulation and provide annual reports about their practices. These reports will help Maryland, will give Maryland important data that helps us understand the landscape for private student loan debt in our state. This committee should know that the bill passed with bipartisan support, 136-0 in the House. It's supported by the Department of Labor and the Office of the Student Loan Ombudsman. I always have such a hard time with that word, and I can't even spell it, and I barely pronounce it. The Ombudsman, and they're going to be the ones who are facilitating this. They're supportive. We have great transparency for federal student loan debt, but it's the private student loan debt that we know almost nothing about. There's a number of other states that do this: Maine, Louisiana, Illinois, and Colorado. And Colorado is probably the best case study for how we can take this information and make it actionable. This committee should also know that there is no impact on business practices. It's just the reporting requirement, and there is no fiscal note.
Thank you. I don't see any questions from the committee, so we thank you. And that concludes the hearing on House Bill 913. We'll now turn to House Bill 1111, Baltimore County Insurance Certificates of Guarantee for County Bond Requirements. Delegate Phillips, good afternoon.
Good afternoon, Madam Chair, Madam Vice Chair. My name is Scott Phillips, representing the 10th Legislative District. And Delegate Smith has made my job really, really easy, because the bill that you just heard, 884, the language in that bill is exactly the same as House Bill 1111. And the only thing that we're changing, instead of Baltimore City, we're adding Baltimore County. So we would ask for a favorable report on 1111. And I will say Prince George's County is doing it. Yes.
Thank you very much. Are there any questions? Seeing none, we thank you for your testimony. That concludes the hearing on House Bill 1111. All right, colleagues, we're now going to turn to some bills that actually have sponsors and witnesses. So I just remind you, the sponsors will have time to present their bills. Witnesses will be given 2 minutes to enhance the sponsor's introduction of the bill. We're going to start with House Bill 27, Consumer Law, Consumer Protection Act, Floral Wire Services. This is Delegate Griffith. Good afternoon.
Thank you, Madam
No
Chair.
relation, no relation.
No relation, but I always support moving a bill sponsored by Griffith. So just throwing that out there. So thank you, Madam Chair. Thank you, members of the committee. For the record, my name is Delegate Mike Griffith, introducing House Bill 27, Floral Wire Services Consumer Protection Act. The original version of this bill did a whole bunch of things. We want to narrow it down to really get to the nitty gritty, which is making sure the public is informed when making some of these online purchases. All I would ever urge you to do is at some point before deciding on this bill, go online and attempt to purchase flowers online. What's going to happen is you're going to have a number of ads as well as other listings for these floral wire services, and also entities called order gatherers. So one is called Terry's Flowers. So you're going to go online, you're going to search for flowers in your town, and it's going to pop up with a local phone number. And you're going to call that phone number. And I asked the question, are you in Bel Air? And they're like, yes, we're in Bel Air. Great. Can I come by and see the shop and make some selections? Well, our permitting's not allowed yet for you to come in here and see the flowers, but I can take an order online, and it's somebody who's clearly from overseas taking a call. And then I directly ask, well, are you actually in the town of Bel Air, or are you collecting orders and then passing them off to other folks? And then they hung up the phone on me. So I'm like, okay. So the concern is they have local phone numbers. This is the order gatherer side. They have local phone numbers. They represent themselves online very clearly that they are local, but they're not. What they're doing is they're actually collecting these orders and then selling them or passing them on to a larger wire service or to the local florists. And local florists are having to spend tremendous amounts of money to try to obtain some of these leads, because these huge companies, these huge national companies worth hundreds of millions of dollars occupy all the search engine optimization, and your local florist gets buried in the weeds unless somebody searches for them very specifically. And then if you do buy flowers from one of the large providers that you're going to hear some testimony in opposition from, it's very difficult to figure out for the average consumer, the uninformed consumer, that you're not buying from a local florist, because all these ads is not necessarily misrepresentation. They say you're buying, provided to you or serviced by a local florist. But it's very unclear that you're not buying directly from a local florist, because the fee structure these big florists have in place take from the florists that I spoke to between 60 and 80% of their profit margin from these local florists. And the one thing all of us in this room have in common, we all have a florist in our districts, and we all have a florist that's about to go out of business in our districts. And you've probably seen lots of florist shops close up shop because of some of these practices, and it's not illegal. But what the local florists have to do right now is they have to pay some money to be able to get these leads from this zip code. Then they have to pay money. Then they have to purchase the vases and the chocolates and the bears from this wire service. So the wire service is making money from that. Then they take a piece of the order, right? And you have to sell the flowers at whatever the wire service says you have to sell them for. And then if your costs go up, they don't care. You're still having to eat the cost or the loss, whatever the case may be. So I don't want to belabor the point. So all this bill simply seeks to do is put some level of notification when you're purchasing flowers online that you are not purchasing directly from the local flower shop or from a wire service. I did speak to the advocates before. I'm happy to discuss any wording or guidance to make sure that the intent of the bill is clearly defined. They have not shared any of that with me to this point. So with that, I would urge a favorable report. Thank you, Madam Chair.
Thank you very much. We'll go to Senator Giles.
Thank you, Madam Chair. And thank you, Delegate, for this bill. I guess I'm wondering, is the intent of this bill to protect Maryland consumers, or is it intended to protect Maryland local businesses like local flower shops?
I believe it's both.
It's both.
Thank you, Senator, for the question. I think we want the consumers to make an educated decision. Do I buy from a flower service where they take a big chunk of the profit? Or do I buy directly from my local florist where they make all the profit and help keep them afloat? At the same time, the wire service, the florist for the same way. So people know that, because we all want to support our local businesses. And I think this bill would do that.
Yeah, and thank you for that. I mean, I agree. I'd want to support our local businesses. I'm wondering, I see the letters of testimony that were submitted, and is there? I'm not sure. I see the unfavorable, and I see the the letter from the Attorney General's office, but what kind of support have you received or has been submitted, if anything, from local florist shops?
It's anecdotal. Every florist I spoke to supports the bill. Every florist I spoke to declined for their own reasons
Right.
to come and testify.
Okay.
So
Okay. All right. Thank you very much. Appreciate it. Thank
Thank
you,
you,
Madam
Senator.
Chair.
Thank you. We'll go Senator Kramer and then Vice Chair.
Thank you, Madam Chair. Good to see you, Delegate. So, pardon me, as amended, the bill requires that one of these 800 flower services simply provide notification, if I'm understanding correctly, to the consumer. Should I call and, I'm looking to order flowers for my sweetheart and also maybe my wife from time to time. And in doing so, all they have to do is simply notify the customer, hey, you're not buying from a local florist. Do I understand? Am I
that is it.
on board?
That is it.
Okay.
And even, and to follow up on one of your questions, Senator, I read the AG's opinion. I don't think the intent of this is for the AG to ever have to enforce anything. It's just, hopefully it's just a deterrent. Because if they're
Policy.
just doing this notification, there is no enforcement mechanism unless somebody just blatantly refuses to do this very simple thing that the florist would be very grateful for. And I think consumers would make some better decisions for it.
Sounds like consumer transparency. Is that accurate?
Yes,
Okay.
Senator.
Thank you for that. Thank you, Madam Chair.
Thank you, Senator. Madam Vice Chair.
Yeah, thank you. How many florists, do you know how many that are online, like Teleflora and all that? Do you know how many there are?
Of the wire services?
Yeah,
It's hard to say. I know of at least 8. But then there are the big ones, like the 1-800 florists and Teleflora. Those are the big ones. But there are also like subgroups called order gatherers. So ones like Terry's Flowers, there's like Anna's Garden. There's a couple of other ones that also feed into this as well. And they're obviously not as organized and professional as the 1-800 florists and those, but so there are countless entities online gathering leads this way.
yeah, well, because, I've, over the years, many years, if I have to order flowers for somebody that's out of state or not even close to me, would call Teleflora. And I've never had a problem with that. But the way you just described it, it sounds like we have Teleflora and the other one, they're like a national kind of a thing. And they, I believe, serve their purpose very well.
Mhm.
But if you get all these ones down below, you're putting them in that below level that you don't know. And trust me, I was the one that put the telephone solicitation in the yellow papers, in the yellow pages years ago. But it was almost a different kind of a situation than you're talking. So I'm just a little confused because I just looked up my florist in my area and her phone number was right there and I can just call her. And if I'm going to order flowers for somebody within 20 miles, I'll call that number. If not, then I would call Teleflora. If I'm going to Montana and I want to send some flowers to Montana, I'd go to Teleflora because, and they have contracts with smaller florists. So I'm just a little confused. That's all.
I mean, I think you're striking at the heart of the matter. So what's happening is, and first and foremost, these florists and Teleflorists, they do a great job. This is not a criticism of their performance because it's all being executed by our local florists that are doing a good job executing
Right.
and delivering and supplying this. But so you have the 2 different tiers of the wire service. You have
There
the
you
big guys that you know about, and then you have the smaller ones that kind of we don't really know about, but they do represent themselves as they are the local florist, right? If I search for flowers in Annapolis, I'm not going to find my local florist until sometimes page 2 or page 3 of Google, right? It's all the ads, all the big ones. And I just see, oh, order flowers from Annapolis, boom, I click that. But what this bill seeks to do is, as a consumer and somebody who supports my local businesses, I want my local business. Sometimes I choose for the convenience. If I'm buying flowers out in South Dakota, just like you, I'm gonna go through the big wire service. But when I'm trying to buy my local, I want to make sure my local florist is capturing as much of the profit as possible to keep them in business. So I want, as a consumer, to be able to make that decision. Do I want to go through the national guy, or do I want to make sure that I'm supporting my local florist? And that's really the heart of the issue.
And I agree with you. You have two tiers here. You got the guys that have been in business forever, and then you got these ones just coming in and scamming. So we have to look at that issue. But another problem that the local florists have is Safeway, Giant, and everywhere else you can go in, and when you're shopping, just picking up the flowers. Every grocery store I go into has flowers. So that's
Absolutely.
part, and I know that because I've been through a couple different florists that have gone out of business, and it's because of that, I think. So.
Yep. And I think, to your point, with supermarkets and all this other fair competition, I just want fairness. And I think this bill may present some fairness.
Thank you.
Thank you. Thank you for your testimony. I don't see any other questions for the sponsor, so we'll go to the additional witnesses that have signed up on this bill.
Thank you, Madam Chair.
Thank you. Calling forward Brian Quinn, Marta Harding, Bernie Marchett. They are signed up in opposition to the bill. Good afternoon.
Good afternoon, Madam Chair, Madam Vice Chair, members of the committee. Bernie Marzik with Cornerstone Government Affairs, here today on behalf of the wonderful company, which is the parent company for Teleflora, respectfully in opposition to House Bill 27. We have provided written testimony to the committee, but just want to touch on a few of the points and give a little bit of background. Teleflora is a national company. They work with over 10,000 florists throughout North America, including over 120 florists here in Maryland. Someone will go online, whether it's in Maryland or in another state, and look to deliver flowers here in Maryland. Teleflora then connects that person's order with a local florist to have that local florist prepare and hand deliver those flowers. A couple of the reasons in opposition, this bill we believe is unnecessary and would be the first in the country of this kind, and obviously not trying to have a patchwork of numerous or even 50 different states putting forward legislation like this that would have different reporting requirements. Second, bill also is a little unclear as to who would be covered by floral wire services based on a definition. You heard a lot from the sponsor about the order gatherers and the different companies that are involved. Third, it is really unclear with the disclosure as to how and when this disclosure would take place for the consumers and for the companies that are involved with this. And then finally, as Senator Guile mentioned, I would ask you to take a look at the Attorney General's letter, which talks about how it is currently illegal under Consumer Protection Act to deceive a customer or to act as if you are a local customer or local business under that Consumer Protection Act. So for those reasons, we would ask for your unfavorable report on House Bill 27.
Thank you, Madam Chair. Marta Harding. I'm here in opposition to House Bill 27 on behalf of 1-800-Flowers.com. Just a little background about 1-800-Flowers. They are an e-commerce brand from which consumers can buy floral arrangements and have them delivered locally or anywhere in the country. If they opt for same day or next day delivery, generally speaking, that is going to be fulfilled by one of our network florists. We maintain a network of florists here and across the country to fulfill orders. If it's a longer time frame, then 1-800-Flowers also has regional distribution centers from which they may fulfill the order directly themselves. But if it's same day, next day, generally speaking, it's going to be through a local florist. Local florists participate in our network because it drives business to them. It is, they're an important part of our business model. A lot of what we do is using local florists, and we are supportive of local florists. And in fact, they were, we believe we were a vital lifeline to florists during the pandemic, when things were shut down. We oppose the bill for a couple reasons, and my colleague, Mr. Quinn's going to cover a couple. I'm going to cover a couple. We think it would be a misleading and confusing consumer disclosure. Just to be clear, when a consumer uses 1-800-Flowers, they're purchasing from 1-800-Flowers. We will have, in those cases where it's a fast delivery, we will have a local florist fulfill it, but the purchase, the transaction happens through 1-800-Flowers. So under HB 27, whether or not a local florist is going to fulfill it, in all cases, we have to tell consumers, by the way, you're buying flowers from us and not a local florist. Put aside how that's a meaningful disclosure, given that the consumer went to the 1-800-Flowers.com website. It's also misleading because, in fact, at the end of the day, it's going to be a local florist that fulfills it. And it's also going to be confusing because on our website, we tell consumers what I basically just described to you. If it's same day, next day, we're going to use a local florist. If it's not, we'll do it directly. So we think it's a misleading consumer disclosure. And for those reasons and what you're going to hear from Mr. Quinn, we are unfavorable. Thank you.
Good afternoon, Madam Chair, Brian Quinn, on behalf of 1-800-Flowers and respectful opposition to House Bill 27. The key terms in the bill are vague or uncertain. The bill doesn't describe how this disclosure is to happen. Is it to happen on a written invoice? Is the website sufficient? Also, the bill is silent as to the timing of the disclosure. Is it only before the purchase? Is it after the purchase? Finally, what is a local florist? A florist within the same zip code, within the same county or state? Also, local to whom? Is it local to the buyer of the flower, or in Senator Klausmeyer's case, do we have to disclose to the recipient you're not buying from a local florist in Montana? These vague terms will make it difficult to implement the bill. And really, disclosure doesn't serve any purpose. The bill's been significantly amended, and at this point, it's unclear what problem it's attempting to resolve. Obviously, a consumer who orders from 1-800-Flowers knows they're ordering from 1-800-Flowers and not directly from a local florist, as the bill would require the consumer to be told. There's been no suggestion that 1-800-Flowers is misrepresenting anything. And in fact, the AG letter, as you've already heard, said it's already a violation of the Consumer Protection Act to misrepresent that a business is a local business when it's not. And then finally, we think the bill unnecessarily singles out the floral e-commerce business vis-a-vis any other of the myriad of e-commerce businesses such as Amazon and Etsy. We just think that there's really no basis to single out floral wire services as opposed to these other online platforms. And for those reasons, we respectfully request the unfavorable report. Thank you, Madam Chair.
Thank you very much. We'll go Senator Hershey, then Senator Guile, then the Vice Chair.
Thank you, Madam Chair. Marta, just because you were speaking about 1-800-Flowers, is the discrepancy here buying versus fulfilling? Is that what we're talking about? Because I think you're absolutely right. If I go on to 1-800-Flowers website, I know who I'm buying it from. The question, I think, becomes who is it being fulfilled by? Does 1-800-Flowers lead me to believe that it's being fulfilled by a local company?
No, Senator, that's part of our concern. The premise is almost that we're telling consumers that therefore we have to disclose to them that in fact they're not buying from a local florist, when in fact there's nothing that we have said on our website or otherwise that would suggest that in all cases local florists are involved. You're right that it is the bill uses the term buying from or purchasing. Right. So that's we're in all cases, like I said, you're buying from us. Right. But there's not. It's misleading in the sense that we, in some instances, have a local florist fulfill it. So that's why we think that the disclosure is going to be confusing.
Yeah, and I guess I think that's what is confusing. I think, whether or not this comes from a local florist, I think that's the impression that most people have. I don't, that was the first time I heard that, 1-800-Flowers has local warehouses that have, flowers sitting in them, that if it is, on a specific day, it can come from there. I think the perception has always been that they are just a partner making arrangements between the buyer and whoever fulfills that.
I think the business models vary. I think Bernie's client may do it one way. We do it, in our case, we do have some warehouses. And depending on, again, time frame, if the consumer wants it there that same day,
Right.
you know, generally speaking, that's going to be a local florist unless there happens to be a warehouse like right up the street. So
Okay. And then finally, do you know much about the structure of this partnership with local florists as far as, you know,
the
what,
business arrangement,
the business arrangement?
I don't.
So we don't know that 1-800 Flowers says for, you know, we'll go out there, we'll do all the branding, we'll be the popular name. And we make an arrangement with the local florist if that's possible for that same day or next day. And by them going to the local florist, there's some type of a business arrangement for a certain either percentage of sale or we don't really, are they different with all different florists?
I can't speak to the particulars of the business arrangement. I can tell you that there is an agreement for florists to participate in the 1-800 Flowers network.
Right.
And it is voluntary, of course. Nobody has to participate in one of these networks or in ours or anybody else's.
Right.
And if they want to, though, there's going to be a contract that's
Sure.
going to lay out the terms and conditions. But I'm not sitting here today able to speak to the
Okay.
particulars of how it works.
All right. Thank you very much. Thank you, Madam Chair.
Thank you. We'll go Senator Guile, then Vice Chair, then Senator Kramer, Senator Reedy.
Thank you, Madam Chair. I'm wondering for anybody on the panel, if you heard at all from the local florist with whom you have a business arrangement with on, well, probably maybe not so much on this bill, but on the issue that this bill is trying to address, assuming that there is a harm that's intended to be addressed here, which, you know, but I'm wondering if you've heard from them at all on this issue.
We
Yeah.
have not,
Okay.
that I'm aware of.
But these local businesses benefit by participating in the business arrangement with your respective clients, correct?
Correct.
Okay, yeah, thank you.
Absolutely.
Appreciate it.
Thank you. Madam Vice Chair.
Yeah, I'm just wondering, when I talked to the sponsor of the bill, he said, I think there's no reflection on either of your clients, but there's the second tier. Do we know anything about the second tier?
The order gatherers
Yeah.
center. Yeah, I was listening to the sponsor's testimony. It sounds like he may have a problem with the algorithm that Google uses to direct searches, but I can tell you, Marta, you did a search this morning for local Annapolis florist, and it came up an actual local Annapolis florist.
Yeah.
But I believe businesses can pay to have the algorithms.
Okay,
shifted.
so I guess you know that you don't know that answer,
But
right?
I don't know.
So,
We are not order gatherers, but having said that, the definitions in the bill are very unclear whether and I don't know the particulars of their business, but whether they would fall in this definition or not, I don't know. But one thing that is clear is that it's already illegal under Maryland law to misrepresent that you're local when you're not.
yeah, okay, thank you.
Thank you. Senator Kramer.
Yeah, thank you, Madam Chair. So is it Mr. Quinn?
Yes, sir.
Okay, Mr. Quinn, you're with It's First and Flowers?
No, I'm with 1-800 Flowers. It's
1-800,
compliant
oh,
with this
excuse me,
part.
no, that's what I just brought up, 1-800 Flowers. All right, I did listen to the bill sponsor and I too Googled flowers. It immediately, evidently, my computer knows I'm in Annapolis and it popped up flowers in Annapolis. I clicked on it and I have something that says Annapolis Florists. We offer same day flower delivery when you order by 11 a.m., local Annapolis time, etc. On the web page, it says Annapolis favorites, and it shows some bouquets. And the website name of the company, and I'm trying to get a handle on whether this is an Annapolis florist or not. Pardon me, it says First and Flowers. That's the name of the company. But the banner across the top of the page here says Annapolis Florists. So I'm looking to see if I can find anything at all that indicates this is an Annapolis florist. And it's got all kinds of information about Here are funeral homes near Annapolis. Here's universities and hospitals near Annapolis. But when I get to the phone number, the actual phone number, not the 800 number, it indicates that it's Central Time, the phone number. That would lead me to believe that perhaps First and Flowers is not actually an Annapolis business if I start trying to drill down, because everything on their webpage gives the impression, and I heard a lot about the Attorney General, has made it clear it's a violation if they're actually misleading. This page is replete with information about Annapolis, but it appears as though the company is not located in Annapolis, and it doesn't actually say they are. Therefore, they would not be in violation of the law, as we kept hearing about, well, the Attorney General's office has already weighed in on this and it's a violation. There's nothing in here that actually says we're an Annapolis company. They just have all kinds of advertising that would imply that they are. So I suspect this is the issue that the sponsor of the bill is looking to address. And I also appreciate the fact that I heard your company is doing this service for local florists. But I suspect that maybe what's happening is that these local florists, because so much business is now done on the internet, are finding if they do not tie into one of these 800 services, that they're getting frozen out of the market. And I would welcome if you could share with this committee what the contract requirements are for a florist who suddenly finds they're getting frozen out in their ability to compete at a local small business level without tying themselves to one of these 1-800 companies. And now what happens to them contractually with regard to what percentage of the business goes to the 800 company and what goes to the small business owner? What percentage of purchasing perhaps flower vases and the little teddy bears that are given with these things? Are any of these 1-800 companies requiring these neighborhood small mom and pop businesses to purchase these items through the 1-800 company? Could you could you enlighten the committee on that? And would it be possible for you, maybe within the next 24 hours, to provide this committee with a copy of the contracts and the requirements of these small mom and pop businesses if they feel compelled to survive in the marketplace and join one of the 1-800 services?
That was a long statement, Senator.
It was, when there's a lot there to unpack,
Sure what the
but
question is.
feel
But
free
I'll
to
be
start
Yes,
unpacking.
yes, sir. Yes, sir. I'm joking, but to be clear, I represent 1-800. To be clear, we represent 1-800 Flowers.
Okay.
Which is different than I believe the 1-800.
Yes, the First and Flowers that I'm
First
looking
and
at here, that
Flowers.
is making it seem as though they're in Annapolis.
Yes, yeah. And I can tell you, there's no suggestion that when you Google 1-800 Flowers and you buy from 1-800 Flowers, 1-800 Flowers is somehow fooling the consumer in that you're buying from a local florist. So please
Understood.
make that clear. So I'll try to take back, a lot of your question and statement seem to be about the relationship between 1-800 Flowers and local florists, just like there's relationships between Amazon and local retailers and mom and pop shops. And those are all in sort of the same category. And if there's something specific we can share with you and the committee that provides some light under that, I'd have to ask the client. I'm not sure what we can do in that area, but if we can, I'd be happy to look into it, sir.
Okay, so you didn't answer any of my questions about requirements of these small mom and pop businesses in their relationship. Would you be willing to indicate whether you have any familiarity if these requirements that I brought up about percentage of sales going to the entity, requirements to buy things like vases and balloons and directly from the company, and do these local mom and pop florists have to sell their product based upon dictates from the 800 service? Can you share any of that with this committee?
Two things. Number one, that seems to be outside the scope of this bill. I don't think this bill addresses your question at all. It's a disclosure to consumer bills. But number two, I don't know anything about the agreements between the florist and the company, but I'll happily look into it, Senator.
Thank you. Appreciate that. Thank you, Madam.
Thank you.
Thank you. Senator Reedy.
Thank you, Madam Chair. I'm just curious, this bill, in your reading, does it apply to you if you're not saying we're using a local florist? Any of you could answer that question, I guess. I'm just curious. Trying to understand this issue more.
It applies to any floral wire service that does business in the state. So if we meet that definition, and as I said, it's somewhat vague, but we think we're erring on the side of assuming we're under this definition.
That might be, is there a way to potentially clarify that to satisfy the concerns? Or I guess I'm curious because I think the point of the sponsor, it seems to me, not to put words in his mouth, but it seems to me that the concern is there are actors, and I actually think, looking at some of the examples that I'm seeing, they're not, in many cases, we're not actually talking about 1-800-Flowers necessarily. I think you guys revealed that your order may be fulfilled by a local florist. It says maybe, or shipped to you from a local florist, but it doesn't necessarily say you're buying. But there are some others that are maybe less well known that are kind of, it seems like they really are advertising, hey, buy from a local florist. You know what I'm saying? I don't know if there's a way. I mean, I don't know if, and I know you're Bernie, I know you're with a different group.
Yeah, with Teleflora, we only use local florists. We don't have flowers. So if an order comes through Teleflora, that order is then placed with a local florist to deliver the flowers.
So, okay, that's good to know. So in your client's case, why is this bill I understand the patchwork issue, and I do think that's a fair point. But why can't you just, if you're advertising that, can't you just say all of our orders are filled by local? I mean, why would that?
I think the patchwork is a big problem, right? I think having one state do it one way, one state do another is the largest concern. The other question is, we're not sure the way the bill is written and from the language that's in there, what that disclosure actually is, when it has to be given. And right, so I mean, Teleflora only uses local florists, but you're making the purchase through Teleflora. So if you go on teleflora.com and buy a dozen roses, you made a purchase with Teleflora.
And you guys are keeping some of the money, obviously, and then obviously you're paying the supplier.
Right.
Yeah.
So then the flowers are delivered by, a flower shop from Hampstead, right? So it's based on where it's coming from. It doesn't seem necessary to me to have a bill to require a disclosure when it's very clear that you're purchasing from Teleflora.
Okay. I'm just, I do get this side of it you guys are saying. I'm just trying to figure out, to make sure there aren't people who are misrepresenting. And it is true, and let me ask maybe Marta, it is true that, because I do know how SEO works, there are companies with a lot more, and I don't know that necessarily the state government should or shouldn't get in the middle of this, but there are companies that obviously can purchase a lot more ability to control the SEO, because you can target a zip code and say, I want to make sure I'm the high bidder for every ad, that maybe Jimmy's flower shop can't afford to do that. I mean, that is fair to say, correct?
Yes, I think that's fair. I mean, this isn't a unique e-commerce. I mean, it's obviously we're talking about flowers and not other products, but the same issues I think are across the board and local businesses in this e-commerce environment. You know, there's adjustments that have had to be made. And again, we work with them. I think part of the issue for us, Senator, just going to your question, is, as Mr. Quinn said, what does local mean? Assuming it means local to the recipient, I'm going to assume that. I don't think the bill says it. It says local florist. Does that mean local to the person I'm shipping to? So if I'm shipping to my aunt in Montana, 1-800-Flowers has to say, you're not buying from a local florist in Montana. I'm not sure why Maryland cares about whether, you know, about local florists in Montana. You know, it's those kinds of issues. Is it the same? Does local mean the zip code of the sender? Does it mean the zip code of the recipient? Does it mean the county? All of these sort of terms are not, we might have an understanding of what it means to us, but that doesn't mean that's going to satisfy the Consumer Protection Division and the law if this law were to pass.
Some of those could be in a definitional clarification, but I do understand your point. Okay, I'm just trying to puzzle through this. Thank you guys very much. Thank you, Madam Mayor.
Thank you, Senators. I see no additional questions from the committee. So that concludes the hearing on House Bill 27. Colleagues, we will turn to House Bill we're going to 694. Labor and Employment Workers' Compensation Licensed Certified Social Workers Clinical. This is Delegate Boafo, and if you have a panel, you can feel free to bring them up with you. Good afternoon.
Good afternoon. Thank you, Madam Chair, Madam Vice Chair, members of the Finance Senate Committee. For the record, Delegate Adrian Boafo here to present House Bill 694. So this bill will allow licensed certified social workers clinical to register with the Workers' Compensation Commission as a rehabilitation practitioner. In addition, it will allow licensed certified social workers clinical to perform an evaluation of the mental or behavioral health portion of a permanent and permanent claim as well. As we all know, with major workforce shortages, especially in rural areas, this bill will expand the pool of professionals eligible to assist workers with evaluation and rehabilitation, and ultimately help Marylanders get back on their feet and healed in time and back to work. HB 694 passed unanimously in the House. It has the support of the Maryland Association of Justice, the University of Maryland School of Social Work, the Maryland Clinical Social Work Coalition, the Maryland Board of Social Work Examiners, and the Maryland chapter of the National Association of Social Workers. And with that, Madam Chair, Madam Vice Chair, I urge a favorable report.
Thank you. Good afternoon, Madam Chair, Madam Vice Chair, and Senators. My name is Jim Lanier, and I'm here on behalf of the Maryland Association for Justice. We are also here, as Delegate indicated, in support of House Bill 839. The bill essentially does two different things. It allows for vocational services for an LCSWC and for impairment ratings. I'm going to focus on the impairment part. So the last major benefit of a workers' comp claim is what, if any, permanent injury does the injured worker have, physical or mental? So right now, the main problem as a claimant's attorney, injured workers attorney that we have, is finding people who will do the ratings that are outside of the Mid-Atlantic, of the Metro Baltimore region. And what this will do is it'll expand the pool of individuals who have the potential of doing an impairment rating for a mental health part of a claim. Because right now, I understand from the testimony from the opposition in the House side that there may be a little more, but to my understanding, there's basically 3 people who do these ratings, and they're in Pikesville, they're in Laurel, and they're in Towson. Nobody, Frederick West, anyone on the shore, anyone in Southern Maryland's coming up to at least Laurel or all the way to Towson or Pikesville to get a rating for a permanency evaluation. And it's an undue burden. So this bill will allow us to expand the additional amount of people who have the ability to do these ratings more cost effectively for the injured worker and a lot more economy, so they don't have to waste all the time and trouble to come all the way here just to get an impairment rating so we can move forward with their claim. Because until we have those impairment ratings, we cannot file for the final benefit of permanency, at least we're not supposed to. We have to have the medical support for the impairment to bring up for permanency. So we're asking for a favorable report on this bill for the workers' compensation part of the impairment part of the bill as well. Thank you.
Good afternoon, Madam Chair, Madam Vice Chair, members of the committee. My name is Byron Warnkin. I'm here on behalf of the Maryland Association for Justice, just to add a few comments with respect to this bill. One of the really important parts of workers' compensation is vocational rehabilitation. And that is when an injured worker cannot go back to their current job and they need to find a new job with a different company. It's an incredibly important facet of the process for any injured worker who finds themselves in that circumstance. And often the mental health component of this is vastly underestimated. People think, okay, well, if you worked in a warehouse, you should be able to answer phones. And oftentimes in our experience, having represented thousands of injured workers, it's simply not true. There needs to be a mental health component to the vocational rehabilitation. It seems in this day and age almost like a no-brainer, but unfortunately, it's not part of our ecosystem. And this bill will help facilitate that and make this significantly easier, which ultimately will put more injured workers back to work and make it easier for them to be sort of productive members of the workforce again. So again, the Maryland Association for Justice urges a favorable on this bill, and we appreciate your time.
Thank you very much. Senator Guile.
Thank you, Madam Chair. I guess delegate, or thank you for this bill.
Yeah, no.
And thank you for your testimony. Or maybe another member of the panel. Are there other states that include LCSWs in with physicians and licensed psychologists as those that can do these types of evaluations? There are other states?
Unfortunately, I'm only barred in Maryland. I do not know.
Okay, delegate.
Yeah, I actually do not know
Thanks,
that answer that question, but we can find that answer for you.
Yeah.
Pretty
Okay.
simple.
Both Jim and I are members of the National Workers' Compensation Bar as well, so we can put that out on the listserv and get some information on that, which we can get to the committee.
All right, thank you. And thank you very much. Thank you, Madam Chair.
Thank you, Senator. Senator Beidle.
Thank you, Madam Chair. And I'm not the social worker, you are. I have a question. If I'm reading this correctly, you would have the social worker make a decision on permanent impairment?
Correct. What would happen is like, as of right now, we would either have to get a psychiatrist or a psychologist to review the medical records and then interview the injured worker and then come up with an impairment report. And that would support for the mental health or psychological portion of the claim to file for permanency, either on its own or if they also have a physical injury, like, you know, a traumatic brain injury that also has a psychological component. You need ratings from both.
Okay.
So this would allow us to get the rating from an LCSWC. They would do basically the same role as a psychologist or a psychologist
So,
or psychiatrist.
Mr. O'Leary, you're not saying that they would make the medical decision, just the psychological?
Well, it's correct. They're making the impairment for the psychological portion, the mental health.
So there
part.
would still be a medical doctor making the medical decision?
For any physical injuries, yes.
Okay, thank you.
Thank you. Back to Senator Giles.
Thank you, Madam Chair. Sorry, just one more question. Is the reason for this, is this because it's difficult to find psychologists and psychiatrists in order to do these types of examinations and determinations?
Yeah.
Is that why?
Yeah, I anecdotally, the doctor in Laurel has a 6-month waiting period to get people in.
Wow.
At least it was the last time I checked. I stopped calling and use other people. I mean, it could be less now, but I know the last time I tried to call that doctor, it was a 6-month period to get people in.
And thank you. Yes, you said that. Thank you very much. Thank you, Madam Chair.
And Madam Chair, if you don't mind, I just want to add two things. In Prince George's County, especially what we're hearing, a lot of folks don't even want to go through the workers' comp process because they know of how long the wait times are going to be as well. So this would obviously expand the pool of folks who will be able to help our Marylanders get back to work.
Thank you very much. I don't see any additional questions from the committee, so we thank you for your testimony. We do have another witness signed up on the bill, Michael Daly. Okay, come on down, signed up in opposition to the bill. You can get started as soon as you're ready. Good afternoon.
Good afternoon. Madam Chair, Madam Vice Chair, members of the committee, Michael Daly from the Maryland Defense Council. Let me just start by emphasizing the Maryland Defense Council fully supports the inclusion of social workers within the vocational process, whether that be in job placement services, counseling, things that they certainly are more than qualified to do and certainly should support the injured workers in that respect. The only opposition we have to this bill is the providing of a medical impairment under the American Medical Association Guides to Permanent Impairment. Under our law, and as determined by the commission through COMAR, the American Medical Association Guides to Impairment, fourth edition, are what are required for a medical provider to use and rely upon in providing a medical impairment. And that's the disconnect, we believe. We believe the bill is very good as it pertains to expanding the role of social workers in providing the services they certainly should be able to provide to the injured workers. It's just the impairment part, because that truly requires a medical evaluation and the expertise that perhaps is not falls within the realm of the work and expertise that they do have. The other problem, and I think it's perhaps not been fully considered, each party can appeal the decision of the Workers' Comp Commission. And if the issue is permanency and it's just the permanency to the mental impairment, that requires an expert under our circuit court rules to be able to be qualified to testify. The MDC does not believe that under our expert qualification rules in Maryland, the social worker would be qualified as a medical expert to provide that impairment. You'd have an injured worker that now has to pay another expert to provide an opinion. For those reasons, we would ask for an unfavorable report.
Okay, thank you very much, Vice Chair.
Yeah, meaning an expert, do you mean a psychiatrist or psychologist, or is that?
Yes, Madam Vice Chair. Currently, the way that the law reads, not only under the Labor Employment Code, but also in the COMAR as determined by the commission, it's only licensed physicians and psychologists who can provide impairments as to psychological, and only physicians who can provide medical opinions as to the physical injuries.
Okay. All right, thank you.
You're welcome.
Thank you. Seeing no additional questions from the committee, we thank you for your testimony, and that concludes the hearing on House Bill 694. Colleagues, we're going to turn to our final bill of the day. That is House Bill 1012, which is workers' compensation fees for legal services. Delegate Valderrama, good afternoon. And if you have a panel, feel free to bring it
Madam
forward.
Chair. Behave yourself, Senator Kramer. Thank you, Madam Chair. Great minds think alike from Prince George's County. With that said, good afternoon, Madam Chair, Madam Vice Chair, esteemed members of the esteemed Senate Finance Committee. For the record, Chris Valderrama here to present House Bill 1012, Workers' Compensation Fees for Services. Basically, the bill is simple and straightforward. It would simply make it easier for claimants who have been denied workers' compensation benefits for medical treatment only to hire an attorney to represent them at an appeal before the Workers' Compensation Commission. Should the appeal be successful, and I emphasize successful, and only if it is successful, this legislation seeks to authorize the commissioner to pay up to an amount of $2,000 in attorney's fees. This is a measured approach to avoid frivolous appeals. To receive attorney's fees, a claimant must be successful in their appeal, and the commissioner determines the amount of attorney's fees, which again is up to $2,000. So currently in these, what we call medical only hearings, many attorneys refuse to represent claimants despite being a good case, if they have a good case, because they cannot get paid for their time or their expenses. So some attorneys take these cases pro bono, but what about the claimants who cannot find legal representation? And that's who we seek to remedy here. They might be able to represent themselves at a hearing against a skilled insurance company lawyer, but that is not what usually happens in many cases. So instead, claimants either forego necessary treatment or they use their private health insurance, medical assistance, or Medicare for injuries that should be paid by workers' compensation insurance. So I've read the opposition testimony over the years. This is not the first time I've brought forth this bill, but I finally got it out of House Economic Matters. And hopefully we'll, I wonder if it's to demise with my as the former workers' comp chair with my Senate House joint chair, Senate chair, we'll see how this goes. But After reading the opposition testimony, it will be said following this panel that the Workers' Compensation Commission is best suited to regulate the awards of attorney's fees in these matters. As I said earlier, this legislation states that it must be successful and in their appeal, and the commissioner determines the amount of attorney's fees of up to $2,000. And with that said, I would urge a favorable report of House Bill 1012. Thank you, Madam Chair.
Good afternoon, Madam Chair, Madam Vice Chair, Senators. My name again is Jim Lanier, and I'm here on behalf of the Maryland Association for Justice, asking for favorable support on House Bill 1012. So here's how it really happens. And this literally happened to me yesterday. I had got an email from a friend of mine who's been a claimant's attorney for years, and she's ready to retire. And she wants to know whether or not I will take over 4 of her files for permanent total disability claims. So these people, they've already been found to be permanently totally disabled for however long, and they're going to have to come back every once in a while for medical care. Well, there's no fee I can ever earn for those claims under the current statute and regulations without exceptional circumstances being found, which is exceedingly rare. This bill remedies that problem, because right now, for me to take those 4 cases, I have to come out of pocket to go get their medical records, because you have to pay to go get their medical records. I can't get my expenses reimbursed, because the claimant's attorney only gets paid from the indemnity, the money that goes directly to the injured worker, not the money that goes for the medical fees. We don't ever get any fee on a medical bill. If we go and get medical treatment for a client, there's never any fee for that. So this would allow the attorney to get paid up to $2,000 if we have to go to a medical only hearing and we have to win. So then we can recoup our expenses and get paid for the representation we're providing that person. Because for me to take those 4 people on, it's a pro bono case. I have to do it out of the goodness of my heart and represent these people for however long they may need something and never get paid. This is the remedy for that problem. This is just this one attorney. This happens on a regular basis, where you will go to the commission and see somebody come in unrepresented because they have a long-term claim and they cannot find anyone to hire because no lawyer can take on the case because they cannot ultimately get paid. This remedies that, and I appreciate your tenacity, Madam Delegate.
Madam Chair, Madam Vice Chair, hello again. Byron Warnken on behalf of the Maryland Association for Justice. Thank you, Delegate Valderrama, for your continued support on this. I'm in addition to being on the board of Maryland Association for Justice, I am Jim's law partner, and Jim would take these cases by the dozen because he is that kind of guy. So he needs people like me to remind him that we cannot take every single case pro bono. We have an unfortunate reality in our system, and that is that we only make attorney's fees on permanent disability. And that leaves a lot of injured workers shortchanged because they might have a serious case that demands medical attention, but for which there will not be permanency. This bill addresses that and helps change what is frankly a quite antiquated system. I think you're going to hear from the opponents of this bill that, number one, this should be accomplished via regulation in COMAR through the Workers' Compensation Commission. The Workers' Compensation Commission has just substantively reformed COMAR, and it did not address this very issue. What happened is, on smaller workers' compensation cases, they raised the fees a bit and they said, oh, you should be happy. They cut fees on serious cases, but they raised them on the less significant cases, and they said, well, this should make up for it. You can keep doing these other cases pro bono because we've given you a bit more on these smaller cases. So that's the truth of the fee regulation. Secondly, the attorney should only get paid on permanent disability. Why? Again, that's just a historical anachronism. Third, this is not a huge problem. Our law firm gets 2 calls a week, and this is one law firm getting 2 calls a week from injured workers who can't get representation. Thank you for your time.
Good afternoon, ladies and gentlemen of the committee, Madam Chair, Madam Vice Chair, Thank you all so much for your time. My name is Kelly Donahue. I am the legislative chair with the Maryland Association for Justice. I'm asking you for a favorable vote on House Bill 1012, and I'm hoping this will actually be a relatively easy one to get over the finish line for 3 reasons. Number one, this bill passed with bipartisan support out of the House. Senator Hershey, one of your delegate 36 members, voted in favor of this bill. It is unusual that you ever see us as trial lawyers sitting up here at the same table with doctors and police officers. And this is the case here. So if it hasn't hit your bill file yet, you will have in your bill file a letter of support from MedChi in support asking for a favorable on this bill. You'll also have in your bill file a written letter of support from the Fraternal Order of Police. Doctors, lawyers, and police all on the same page on this bill. And why is that? And that's because this bill is not about attorney's fees. This bill is about remedying David and Goliath. Every time a workers' compensation claimant needs a medical only hearing and goes before the commission, the only reason they go before the commission is because the workers' compensation carrier has said, no, sorry, worker, you don't get your care paid for by workers' compensation because we don't think you need it. So then the claimant has to go to the commission and say, Commissioner, please help me. And guess what? Every time that happens, the workers' compensation insurance company is represented at that hearing by a lawyer. And the claimant doesn't get the same benefit. They show up with a shopping bag with their medical records and they do the best job they can. And their claim oftentimes, more often than not, is denied. This bill fixes that. And it is also a fiscally responsible bill because the responsibility should be the proper person paying for care. If it is a work-related injury, that care should be paid for by workers' compensation insurance, not by Maryland medical assistance, and not by taxpayers. Happy to answer any questions. Thank you so much for your time.
Thank you. We'll go to the vice chair and then Senator Beidle.
Yeah, you know what? I just got 6 minutes of testimony, plus the delegate. As the chair of the Oversight Committee, I would have appreciated even knowing that the bill went in, because the last I had heard was that the Workers' Comp Commission came out with a ruling. And that was 2 weeks ago or a week and a half ago. And at this point, this is the first I'm hearing of it. So, and I know, Jim, you always complain about it, and I know that. But out of courtesy, I wish you would have come and talked to me about this.
My apologies.
Yeah, so, I mean, because now I have to figure out what's going to happen with the bill. And
Madam
Okay.
Vice Chair, I am the legislative chair for MAJ, so ultimately I will take responsibility if there was a breakdown in communication. I do apologize.
yeah, there was a big breakdown.
So I am certainly sorry for that. It never, it was not something that was on my radar, that it was not adequately communicated, but I know you're regularly in communication with our lobbyists. We'll certainly follow up and it won't happen again. So I apologize.
Thank you. Senator Beidle.
Thank you, Madam Chair. Mr. Lanier, you testified about the people that you take pro bono because they don't have an attorney. Are they the only people this bill applies to, the people that have lost their original attorney, where that original attorney was paid, or does this apply to everyone that has to come back for medical?
The thrust of the bill was always to help those who are unrepresented be able to hire an attorney for long-term workers' compensation claims. That was always the focus of the bill. The bill language had to be expanded because of, as the senator and the delegate are aware, this bill has been around for 4 years now. So we've tweaked the language over time because some people told us first it was too narrow, then it was too broad. Right now, it applies to medical only hearings, but the thrust of the bill was always meant to help those who cannot find an attorney hire an attorney. But yes, it does talk about any hearing in which medical only is the issue, because it's always our burden to prove it. And we never get paid on any medical care treatment cases. And it's also up to the commission. If it's there for a medical case and that person hasn't gone to permanency yet, they don't have to award us a fee. We still have the commission's discretion to make that decision.
Thank you for that answer.
Yes,
Let
ma'am.
me ask the question a different way. So if you had a client that you took in front of the commission and you earned your 35% fee, and a couple of years later, you need to bring that same client back for medical, you get paid again for that same client?
If I may,
Mhm.
Senator?
Yes, sir. Thank you.
So the fees are not nowhere near 35%,
Okay.
Senator.
Whatever.
The fee on a $100,000 case that would probably go about 3 years is about $12,000. So it's, I just want to make sure that we're clear on the fees. Workers' compensation is not like other areas of personal injury law.
So while you're answering, Mr. Warren, so that same client that you earned your fee on the first time, if you take that client back for medical extension, for additional medical, you want to get paid again another 2,000. Is that correct? Is that what the bill says?
Absolutely. And I think there,
Mr. Lanier just confused me in his testimony about the pro bono and the clients that had lost their attorney. So I just wanted to make sure I was clear.
right now,
Thank
we do that.
Thank you.
Thank you.
Okay, I don't see any questions additional for this panel. I just wanted to follow up on Senator Bidle's question, and this workman's comp area has just been a little complicated this session. So if there is a client, for example, that has an injury that's represented by an attorney, that attorney, for whatever reason, stops practicing, retires, whatever, that person comes to you. How is that handled now?
Let me jump in. All right, so Madam Senator, so generally there's 4 major benefits of workers' comp. The main way in which a lawyer for an injured worker gets paid is at the end of the claim, the 4th benefit call for permanency, and we get a percentage of the permanent benefit for the person. But medical care can go forever. You can, if you have a person like the individual contact me as a permanent total disability client, they're going to need medical care because of the nature and extent of the injuries for the rest of their life. But they may have been found perm total 20 years ago. Well, there's no more fee to be earned because that lawyer earned the fee. But that person still may have to come back and fight for additional medical care. They can't now, like my friend who's going to retire, she's gone. Who are they going to find? They can't find anyone because this is what this remedies. For me to then take over that case for her and take on the liability and responsibility for that person, I'm looking to then get paid. God forbid I have to go and fight to get him another MRI. Because you can go on a medical hearing in front of the commissioner for everything from a pill to a surgery.
Got that part. I just
Yes,
wanted,
ma'am.
I just wanted to make sure that we were talking about people that had a case that for whatever reason now needed to go back, whether it was for an extension or they had an additional medical challenge. And so this is sort of a second appearance, a second case after whatever
Well,
period of time.
pick on your language a little bit, if I may,
Okay.
Senator.
Yep.
There's always one claim, but we can have hearings on any issue that is in dispute between the insurance company and the injured worker. I had one claim where I went to 13, I had one hearing every year, literally every year I would have a hearing for this gentleman because they denied his medical care every single time. And so every year, like clockwork, I'd file issues and we'd have another hearing and then he would get authorized. And I had literally 13 hearings because he got hurt in 2005 and we just kept going every single year. Now this bill would not affect that gentleman because he eventually went to permanency and I did get a fee for that. But the claim is always one claim, but you have to go back every time you get a denial from an insurance company if the client still needs the medical care, because it's always the claimant's burden to prove that the medical care is under the claim. I hope that makes a little more sense.
It does, but I see that there's a lot more questions that could
Yes,
be
ma'am.
asked, but in the interest of time, we're going to move. Oh, sure,
I just
Madam
want-
Vice Chair.
Just very quickly, Jim, you said that the Workers' Comp Commission came out with the regs. We know that. And you were all right with the rest of the regs, but this part of the regs, you are what you're upset about.
Go ahead.
If I may, Madam Vice Chair. The regs did not address this issue. We did not ask for the benefits of the regs. They were sort of haphazardly done, it seemed to me, and I don't mean to disparage the commission because they worked hard on them. It's a complicated issue. But ultimately, this issue, the very issue that started this process 4 years ago, has not been solved. So the answer is no. And if this bill were to pass, we didn't ask for those reg changes. What we asked for was this problem to get solved.
Okay, I just wish somebody from the commission were here, but they're not, so that's okay.
Okay, thank you. I don't see any additional questions for this panel, so we thank you for your testimony.
Thank you.
Thank you, Madam Chair.
Thank you. We're going to call forward Carmine D'Alessandro, Michael Daly, Julie Murray. Signed up in opposition to the bill. Good afternoon.
Good afternoon, Madam Chair. Madam Vice Chair, members of the committee. For the record, my name is Carmine D'Alessandro. I'm Chief Legal Officer for Chesapeake Employers Insurance Company, also the President of the Injured Workers Insurance Fund. Chesapeake is the largest carrier of workers' compensation insurance in the state, with about 20% of the market, and the Injured Workers Insurance Fund oversees the state of Maryland's workers' compensation program. So in total, we see about 1 in 3 of all workers' compensation activity in the state. We are here to respectfully oppose Delegate Valderrama's bill. As you've heard, currently, the entire fee structure in workers' comp is set forth in COMAR. Each claim or each case is assigned a specific fee. I believe right now it's in the low 20,000s, but every claim, there is a cap on the fee you can get. It's about $20-some thousand. So when you represent someone, whether you get paid at the beginning, at the end, there is a pot in each claim for you to get. Once that pot is expended, there's no more money to get, but you've been paid for the claims. There is no pro bono work in workers' compensation. You've already been paid for the work, and all fees are contingent. So our opposition is mainly that this is a COMAR issue. It's always been in COMAR, and we wouldn't want it split up. And secondly, fees have always been contingent in workers' compensation. Never has someone besides the injured worker had to pay for the legal fee in his or her claim. So this would be 2 significant departures from well-settled law. To Delegate Valderrama's credit, she's been pushing this bill for 4 years, and there have been significant changes in those 4 years because of this issue. One, COMAR does now allow the commission to award a fee when there's no money payable to the claimant. So the commission now can award a fee when it's a medical-only case. 2, COMAR increased the fees on settlements. COMAR now has increased, as of March 9th, the cap from 20% of the average weekly wage to 60% of the average weekly wage. So in effect, I know I'm going to finish up, all of the concerns over the last 4 years, the commission was asked to address, and one by one, they've had addressed them. The last piece was just March 9th, when they voted to increase that cap on all fees, thereby allowing claimants to get in more money in these cases. So for those reasons, we would respectfully oppose and ask for an unfavorable report. Thank you. I apologize for going over.
Thank you, Madam Chair, Madam Vice Chair, members of the committee. Michael Daly from the Maryland Defense Council. One thing I want to make sure is clear and clarified from testimony that was previously given. This bill would apply to the life of any claim, even if the injured worker still was entitled to receive indemnity benefits, meaning that, so let's say somebody files a workers' comp claim, and then 6 months down the road, they got paid lost wages for a period of time. There was an issue regarding medical treatment. There are attorney files for medical treatment only, but they're still entitled to indemnity benefits. They have a lifetime of medicals left, in addition to many, many years of indemnity benefits left. Under this bill, if that attorney goes before the commission just on a medical only issue and says, we're successful, so now the employer and insurer have to pay us money, they will still get fees for the remainder of the indemnity life of that claim. So this is not limited to just those cases in which an injured worker's lawyer can no longer get paid. This applies from day one of the filing of the claim. And I think that's very important because I don't think that that was clarified for the members of the committee. Number 2, workers' compensation, as Mr. D'Alessandro said and explained, has always been contingency only. And similar to an auto accident that we all may have a little more familiarity with seeing it on whatever form we see, the lawyers get paid at the end of the claim. That same logic applies to these workers' comp cases. They're not getting paid. Those lawyers aren't getting paid in the lifetime of the auto accident. They get paid at the end of the case, whether it go by verdict or settlement. That same logic applies to these cases. And finally, the COMAR provisions that were well looked at by the commission and looked at by a former workers' compensation practitioner, commissioner, who's the one that evaluated it, just passed. So those were increased significantly. For those reasons, we'd ask for an unfavorable report. Thank you.
Thank you. Good afternoon, Madam Chair, Madam Vice Chair. Julie Murray, also present on behalf of the Maryland Defense Council. I would also like to clarify some of the remarks that were made by the proponents of the bill and by my colleagues here. Something to bear in mind is that there was a comment made that the regulations before the commission were haphazardly passed, which was absolutely not the case. The commission appointed one of their commissioners who was a claimant's attorney for 30 years to review COMAR, draft the proposal, and it took months to do. Public hearings were held, and you heard that those regulations were just passed. A part of those regulations did include, and the citation to that is in our written opposition, but it's COMAR 14090403, and that permits the commission to award an attorney's fee to be assessed against the claimant in situations where the indemnity is closed or there is no indemnity payable to the claimant. That is the exact issue that you heard from Mr. Lanier that he wanted to be addressed. This bill goes way beyond that and permits an award of an attorney's fee up to $2,000 to be payable not by the claimant, but by the employer, the insurer, the self-insured employer, or the uninsured employer's fund. The other thing that I just wanted to clear up is that in addition to the fact that this is already permitted by COMAR, claimants' attorneys in this case do have some other options, which is that they can reopen a case after permanent partial disability benefits are granted. So this bill is not limited to situations where there is no more indemnity. Even after a case goes to permanent partial disability, if a claimant reopens that for additional medical treatment, they can come back for additional worsening and get another attorney's fee. So for all those reasons and the ones articulated in our written opposition, MDC does oppose this bill and would respectfully request an unfavorable report.
Thank you very much. I don't see any questions for this panel, so we thank you for your testimony. We do have a virtual witness signed up on the bill, so we're going to turn to Matt Pavola.
Yes,
Good
correct.
afternoon.
Good afternoon. Thank you, Matt Pavola. Thank you so much. I'm with the Maryland Association of Justice as well, and I apologize that I was unable to get there in person. It's so much more rewarding and beneficial to be there in person. I want to apologize. I want to thank Delegate Valderrama for sponsoring this again and working so hard to help us get this very good legislation passed. Clearly, I'm promoting a favorable decision on this. I also want to personally, and I do mean personally, apologize to Senator Klausmeier, my senator. I have assumed the responsibility over the years of communicating to you, not necessarily specifically on this, but just over the years I have, and I dropped the ball. And please forgive me. I should have made this clear that MAJ did not think the new regulations addressed this situation and that we were pushing this bill forward. And again, please forgive me. Briefly in response, because I'm already down to under a minute. First of all, that statute that Mr. D'Alessandro referred to, the regulation, it calls for exceptional circumstances. Exceptional circumstances, the commission has the discretion. Those are very rigorous exceptional circumstances that would allow the commission to grant an attorney fee. Number two, he made the point that actually it was Mr. Daly said that in those situations where there's no compensation, that the bill could apply even when there is compensation left. But when you read it carefully, it says, if no compensation payable to a covered employee, I think the commission would read that strictly and mean in only those cases where there is no benefits left. Finally, and quickly, we did not want to say that those regulations were haphazardly drawn. That's misstating what they were thoroughly written up. It just didn't address this issue of medical bills. Thanks so much for the opportunity to speak.
Thank you very much for your testimony. I don't see any questions from the committee. So we thank you for your participation in the hearing, and colleagues, that will conclude the hearing on House Bill 1012. That is the final bill we have before us today. We'll take a quick break and come back and do some voting. Thank you.